What's wrong with my pelvic floor? Why is it that my pelvic floor is not working correctly? Or how do I know if my pelvic floor is working correctly? If you struggle with leakage, especially urinary leakage, when you're running or jumping or playing with your kids, you may feel like you have a weak pelvic floor. If you struggle with not being able to fully void either side, either one, you may actually have a tight pelvic floor. And actually, all of those issues can be caused by the same problem. So today we're talking about the pelvic floor and how it can present with so many different symptoms. We have a lot of women who come in to see us who they have a bulge in their pelvic floor that maybe they have noticed either when they're washing or maybe their OBGYN has noticed, and that brings them in to see us. But there's a lot of women out there who don't know that pelvic floor physical therapy can actually help if you have struggle with peeing when you're running or laughing or jumping or anything like that, as well as if you feel like you can't fully void when you need to, because all of those things are connected. So for my friends who are struggling with peeing when they're running, laughing, jumping, and who have been told that it is just normal after you have children to have this happen, I want to tell you it is normal in the fact that many people have it, but it is not normal in the fact that your body is not designed that way. Just because you've had children does not mean you should have issues with incontinence. The incontinence is telling you that there's something wrong with your pelvic floor, and we can deal with that. It's a muscle. It's actually a bunch of muscles, but it's muscles, just like in other areas of our body. And would you say that if your biceps was contracted all the time and you couldn't fully straighten your arm, would you say, oh, I have to deal with that? Well, no, of course not. It's a muscle. You know that there's something that can be done with that. The pelvic floor is no different. Now, if you struggle to be able to fully void from either side, chances are that your pelvic floor is too tight. Now, this can be caused by a variety of issues. There can be a trauma, right? You may have fallen, you may have had trauma from childbirth. That obviously, makes sense to have something like that. However, you may have also had emotional trauma, and it's important to know that emotional trauma affects our brains and every muscle in our body, including the pelvic floor, much the same way that a physical trauma does. Our body kind of can hold on to these memories, and it can also kind of stick them or stuff them down. And they tend to stuff down weight into our core. And we start seeing the problem in the pelvic floor and in the gut. Those are the two most common places for women to struggle with issues like that. So it's important to know that even if you don't have a direct physical trauma, an emotional trauma may still be sitting there and may be causing you the same problems. You may have had some difficulties with childbirth. You may have had to have an episiotomy, which causes increased tearing in the area, and that scar may not have healed correctly. Many women have told me that they have had an episiotomy and that the doctor said that everything healed up correctly. But when we go and check the pelvic floor, that scar tissue is still bound down and it's pulling all of the muscles in the pelvic floor. So which means if they're getting pulled, they can't move correctly. And if they can't move correctly, then they can't function correctly. And remember, our pelvic floor is part of our core, right? So we need to be able to use our pelvic floor regularly and correctly. Also, if you're going through menopause, there's definitely some changes that come along with that. And we know that the changes in estrogen can have a direct impact on the pelvic floor. If you're in perimenopause right now and you're starting to notice some changes, now is the right time to get help from a pelvic floor physical therapist, because it does get harder to build muscle mass as we lose the estrogen levels. So as our bodies change, things become a little bit more difficult. So if you're perimenopausal, I definitely recommend you seeking out help now so that you can get this taken care of before we deal with the other chemical ramifications of menopause. You also may have had a direct injury to your pelvis, either from that fall or from something else. And that obviously, even if it's a bony, like I've had some people who have fallen on their hip And the changes in the bone and how the hip is functioning affects how the pelvis is moving, which then affects the pelvic floor. So you may think, oh, I had this fall, but it wasn't. I didn't fall on my butt, or I didn't fall on my pelvis. But it can still have an impact even if you took that shock through your knee or through your hip. So that's definitely something to consider, because your alignment may be off, and then that may be showing up somewhere else in your body, specifically in your pelvic floor. Now, the other thing that we've been talking about a lot lately around here at Physical Therapy for Everybody is the fact that your pelvic floor works together with your diaphragm, or actually it works inversely with your diaphragm. Now, this makes sense if you think about the fact that when you poop, you got to kind of bear down, right? So your diaphragm has to contract to push everything out. Well, your pelvic floor has to relax so that everything can come out, right? So they're supposed to work inversely. However, if your pelvic floor is tight, your diaphragm doesn't all of a sudden go loose, right? That wouldn't make sense. It would make it really hard to breathe. So what the diaphragm does instead is it becomes really tight too. Now, once your diaphragm's tight, it's going to hold that pelvic floor tight, which creates this like pressure. We kind of consider the core to be like a can, like a soda can, and you want to think about how much pressure is in there, right? We need to be able to release pressure and let it go, but if you are having tight top, tight bottom, you can just see how the pressure is just gonna out the sides, right? Which is not what we want to see. So a lot of our pelvic floor patients, we actually work on diaphragm and breathing, because that is super important to be able to keep the diaphragm tone decreased, which keeps us from getting that pelvic floor tone ramped up again. Now, how else does this all relate together? Well, the other thing that can tie all of these issues together is the vagus nerve. So now the vagus nerve was really popular a couple years ago, and everybody was talking about it, and rightly so, in all honesty, because it is so important. The vagus nerve is like your calm down center, all right? It runs through your diaphragm, and when you take a deep breath, it stimulates the vagus nerve, and it causes your body to kind of relax, and it allows more of that blood flow to go to those other organs, and it gets you out of that fight or flight response. So if you suffer with something like anxiety, people will tell you, well, you just need to breathe. Well, I know it's easier said than done when you're suffering with anxiety, but it is true, because when you breathe, you get more oxygen in, so your body feels better. It stimulates the vagus nerve, which allows the chill out reflex to go into play. And then it also will help to relax the pelvic floor. So you may have noticed that if you're really stressed, it's more difficult to go to the bathroom. If you've ever noticed that, then that's probably because your vagus nerve is not working correctly and everything's just kind of ramped up in that fight or flight response. So if any of this is resonating with you and you're wondering, like, what can I do about this? We have a really simple, couple simple ideas for you to implement today to be able to help you release urine and get all of that out, okay? So 2 things you can do. 1, if you find yourself sitting there and you know you need to pee, but you just can't get it out, or you can't fully get it out, what I recommend trying first is deep breathing. So just trying to take a couple deep breaths in and out, get that diaphragm to relax, helps the pelvic floor to relax, stimulates the vagus nerve. It's just basically good for your body in general. Now, if you feel like that's not completely working, then my second tip is to kind of take some stress off the pelvic floor, and you do that by leaning to the side. Now, some people, it works better right. Some people, it works better left. The truth of the matter is that's dependent on which side of your pelvic floor is tighter, but obviously you might not know that right now, so try both. Try one, see if that helps. If it doesn't, try the other one. But that should help you be able to get that urine or poop out so that it's not stuck inside your body, because when it is, it definitely leads to things not feeling good, obviously bothers your gut, which leads to other problems. We know that our gut is our second brain, so if your gut's not working correctly, that increases your anxiety, right? You can see how all of these things are connected. So it's important to be able to get everything out that needs to come out. Now, if you feel like everything comes out too easily, it could still be a tight pelvic floor, because that pelvic floor may not be able to function correctly because it is so tight. And that is most commonly what we see here at Physical Therapy for Everybody, is that it's not actually that people have weak pelvic floors. It's not actually that you need to do more Kegel exercises. It's that we actually need to decrease the tone in your pelvic floor. So if you have any questions, feel free to drop them below. We'd love to make another video and help explain this to you. And definitely hit the subscribe button, because we're always posting new videos to help educate you about what's going on with your body. Have a great day, everyone. Bye.